Hello, my name is Jeffrey Smith, and I am discussing today the informed consent in regards to counseling sessions between the counselor and the client. I'm also looking at how the counselor intern is affected by informed consent as well. Being from Texas, I have looked at the Texas State Board of Examiners of Professional Counselors, and the rules and regulations set in place by the state towards counselors as far as informed consent, as well as the ACA Code of Ethics and what they have to say in regards to informed consent. Both the state of Texas and the ACA have looked at informed consent as being the signed, written receipt of information that goes between the client and the counselor. This information regards the financial responsibility of the client as well as the expectations of these sessions. It lays out for the client what the goals are, what the expectations are to reach that goal, and the therapies that will be and treatments that will be used to reach that goal. The ACA talks of the informed consent as clients having the freedom to choose whether or not they want to enter or remain in a counseling relationship. With that said, informed consent also takes into consideration the involuntary treatment of individuals that have been placed under a court-ordered appointment, in which case informed consent would include the receipt of that appropriate court order. The thing I found most interesting about informed consent is that it centers highly around the client's rights as individuals and not so much around the sessions and expectations of what will happen in these sessions. I looked at the informed consent form from the Texas State University Counseling Department and the counselors that actually are practicing currently and how they use this form. This form informs the clients on the fact that they are able to ask questions on what to expect during and as an end result of therapy, as well as giving them the opportunity and the option to, if they choose, to discontinue or cease therapy at any time. It allows for the client to be able to have the rights to what's being done, the treatment that's being done, and to be able to view any form of report or record from the therapist. The informed consent and the way that it is done with the state of Texas takes into consideration how the client and the counselor will have a developed relationship during their time of therapy, and it is one of the pieces of information that must remain on record for the counselor at least 6 years after the relationship has ended between the counselor and the client.